Welcome to the final episode of the PTCB Top 200 Drug Series. I'm Izzy, certified pharmacy technician with 9 years of experience. We have covered 192 drugs together. Today, episode 17, the finish line. We are covering the final 8 essential drugs that didn't fit into our previous therapeutic spotlights, specifically focusing on gout, osteoporosis, urinary health, and essential supplementation. These 8 drugs are classic PTCB test questions because they focus on patient counseling points and specific side effect profiles that a technician must recognize to ensure safety. Gout agents, osteoporosis agents, urinary agents, ophthalmic agents. Let's knock these out and officially complete the top 200. Here is the framework. Bisphosphonates, the dronate suffix, Alendronate, Fosamax, Ibandronate, Boniva. Mechanism: they inhibit osteoclast activity, slowing down bone resorption to treat osteoporosis. The PTCB critical facts. The absolute most important counseling point is the upright rule. Patients must remain upright, standing or sitting, for at least 30 minutes after taking these to prevent severe esophageal irritation or ulceration. Also, take with a full glass of water on an empty stomach. Gout agents: Allopurinol, Ziliprim, Colchicine, Colchicine. Mechanism: allopurinol inhibits the enzyme xanthine oxidase, decreasing uric acid production. Colchicine interferes with leukocyte migration to inflammation. The PTCB critical facts. Allopurinol is for chronic gout management, not acute flares. Colchicine is for acute flares. Allopurinol requires patients to stay hydrated to prevent crystal formation in the kidneys. Urinary agents: Tamsulosin, Flomax, Finasteride, Proscar, Oxybutynin, Ditropon. Mechanism: Tamsulosin is an alpha-1 blocker that relaxes smooth muscle in the prostate. Finasteride is a 5-alpha reductase inhibitor that shrinks the prostate. Oxybutynin is an anticholinergic that relaxes the bladder. The PTCB critical facts. Tamsulosin counseling involves orthostatic hypotension. Watch out for dizziness when standing. Finasteride is a teratogen. Pregnant technicians must not handle crushed tablets. Oxybutynin, anticholinergic side effects: dry mouth, blurred vision, constipation. Ophthalmic agent: Latanoprost, Zalatan. Mechanism: prostaglandin analog that increases aqueous humor outflow to lower intraocular pressure. The PTCB critical facts, stored in the refrigerator when unopened. Common side effect: iris darkening and increased eyelash growth. Vitamin D, ergocalciferol, cholecalciferol. Mechanism: essential for calcium absorption and bone health. The PTCB critical facts, available in prescription strengths, often 50,000 units weekly, versus OTC daily strengths. Now let's lock in the brand to generic connections. Alendronate, brand name, Fosamax. Bisphosphonate, take with water, stay upright. Think Fosamax, the bone builder, the esophageal ulcer risk. Allopurinol, brand name, Ziliprim, gout management. Think Ziliprim, the uric acid blocker, chronic gout only. Tamsulosin, brand name, Flomax. BPH, think Flomax, the flow helper, the orthostatic warning. Finasteride, brand name, Proscar. BPH, think Proscar, the prostate shrinker, avoid if pregnant. Oxybutynin, brand name, Ditropon, overactive bladder. Think Ditropon, the dry mouth, bladder relaxer. Latanoprost, brand name, Zalatan, glaucoma. Think Zalatan, the lash grower, the color changer. 5 questions, PTCB format. Question 1. A patient is prescribed Alendronate. Which counseling point is mandatory for safety? A. Take with a meal. B. Remain upright for at least 30 minutes after taking. C. Crush the tablet if you have difficulty swallowing. D. Take immediately before bedtime. The answer is B. The upright counseling rule is to prevent severe esophageal injury. Question 2. Which medication is contraindicated for handling by pregnant technicians due to its teratogenic potential? A. Tamsulosin. B. Allopurinol. C. Finasteride. D. Latanoprost. The answer is C. Finasteride is a potent teratogen. The tablets should never be handled by pregnant women. Question 3. Allopurinol is indicated for which condition? A. Acute gout flare treatment. B. Chronic management of gout. C. Osteoporosis. D. Glaucoma. The answer is B. Allopurinol is a xanthine oxidase inhibitor used for chronic management, not for the acute pain of a gout flare. Question 4. What side effect is most associated with Tamsulosin? A. Hypertension. B. Orthostatic hypotension. C. Dry mouth. D. Increased eyelash growth. The answer is B. Because it is an alpha blocker that relaxes blood vessels, orthostatic hypotension leading to dizziness is a key counseling point. Question 5. Which of the following counseling points applies to Latanoprost? A. Take with food. B. Store at room temperature at all times. C. May cause darkening of the iris color. D. Should be taken as a swish and swallow solution. The answer is C. Iris darkening and increased eyelash growth are well-documented side effects of prostaglandin analogs. Alendronate, Dronate, Allopurinol, Tamsulosin, Finasteride, Oxybutynin, Latanoprost, vitamin D, Bisphosphonate upright rule, gout chronic versus acute, BPH hypotension versus teratogen warnings, anticholinergic dry mouth, glaucoma iris changes. You have officially mastered the series. You have built a powerhouse foundation of drug knowledge. I'm Izzy. Congratulations. Subscribe and I'll see you soon.